Welcome back to the NRCME Exam Walkthrough Audio Companion. We are on page 5. If a driver is on anticoagulants, they must be stable for at least 1 month, have a copy of INR reports, and they will get a maximum certification of 1 year. If there's a history of DVT, it's a maximum certification of 1 year. However, if chronic thrombotic venous disease without symptoms, a patient could possibly be certified for up to 2 years. Now, if there's a history of a PE or a pulmonary embolism, you must wait 3 months without a PE, and then a maximum certification of 1 year. What about leg claudication? Claudication, there's a 3-month waiting period after the surgical repair, and then a maximum certification of 1 year if no symptoms. If there's a history of PVD, peripheral venous disease, pain at rest is disqualifying because reduced dexterity in the affected limb. There's a maximum certification of 1 year. However, superficial phlebitis and varicose veins can be certified for the maximum of 2 years. If there's a pacemaker, not a defibrillator, but just a pacemaker alone, treating underlying AV block, you must wait 1 month post-implantation. But if it's treating underlying neurocardiogenic syncope or hypertensive carotid sinus with syncope, that requires a 3-month wait. So a 1 month wait if it's treating AV block, 3-month wait if it's treating neurocardiogenic syncope or hypertensive carotid sinus with syncope. That's a 3-month wait. Maximum certification is 1 year as long as documentation shows that it's a functioning pacemaker and there are routine pacemaker checks. So that's very important. You get the documentation for functioning pacemaker and routine pacemaker checks. What about supraventricular arrhythmias? There's a 1 month waiting period after adequate anticoagulation. There's aflutter ablation and or asymptomatic period. It's a 1 month waiting period. Maximum certification is 1 year if heart rate is controlled and annual cardiac clearance letter. You need a cardiac clearance every year. Maximum certification, 1 year for supraventricular arrhythmias. What about ventricular arrhythmias? There is a 1 month waiting period after the drug or therapy. It's a maximum certification of 1 year if asymptomatic and cardiac clearance is required. You do not certify if there's sustained VTAC, that's greater than 30-second episode, or non-sustained VTAC with an EF, ejection fraction, of less than 40%. Or if there's a diagnosis of hypertrophic cardiomyopathy, long QT syndrome, or Brugada. Those are all disqualifying. Pay attention to these disqualifying aspects to ventricular arrhythmias. Again, one more time, sustained VTAC, non-sustained VTAC with an EF less than 40, hypertrophic or restrictive cardiomyopathy. For more information about the other products we provide regarding the DOT exam, in other words, the NRCME, please go to our website and purchase our products there. Thank you for your support.